Ladies and gentlemen, welcome back to one of Mike, the premier business radio program. I'm your host, Mike King. I appreciate you being here with me. This is part of the Mike King Biz Radio Network, which is ESPN Richmond 106.1, The Choice 105.3, as well as International Business Growth Radio. So you know what time it is. You can follow me on all the social platforms on the Mike RVA, as well as Mike King Biz. So this is the Poplar Springs Hour, but we've taken our talents on the road. We're going down to the Tidewater area. So we're down with the good friends down at Newport News. It is the Newport News Behavioral Health Center. Gentlemen, welcome to the program.
Thank you, sir.
Thank you, Mike. Nice to be with you.
All righty. So I always say it's a business show. So this is your elevator pitch. Tell us who you are and what you guys do.
So we are Newport News Behavioral Health Center, located down here in Newport News on the border of Williamsburg and Newport News, basically. We provide long-term residential services to adolescents, and we also have an acute hospital where we provide immediate crisis stabilization to children and adolescents as well.
So the age category you guys handle, what would that be?
So on our acute side, it is 8 to 17, correct?
Yes, that's
and
correct.
then on our RTC side, it is 11 to 17, right? Yep.
All righty. It's an important topic, so we always shout out to our good friends over at Poplar Springs. We always had the conversation with them about this time of year. It's rough on people from a mental health standpoint. So one of the great parts about having my own radio show is I get to talk to the experts. Gentlemen, how are we doing out there? Now that we've made it through Christmas and New Year, everyone's always talking about a new year, new you. I'm going to do right. I'm going to not do all that bad stuff I was doing in 2022. It seems like that lasts about 13 days.
Right. Right. So again, us folks in the helping professional fields, we always get excited when we hear about behavior change. But what we understand is that long-term behavior change is not easy, right? And I think sometimes when people use the New Year's 12/31, 1/1 as the catalyst for their behavior change, they don't really take a big enough bite into that apple. And what I always like to say is that, behavior change is a mindset, right? And I've always kind of benefited from having that growth mindset, which is just a continuous commitment to self-improvement and to leaning in on your talents and your skills and knowing that you can continue to further improve those skills and your talents with hard work and support and collaboration with your peers. And that's just from a more general business standpoint. I think if we take a deeper dive into kind of behavior change and how that's attached to mental health challenges or substance use disorder challenges, is that it's critical that you get help from professionals. We're talking about life changing situations. We're talking about increased statistics in suicide, especially amongst men in mine and Eugene's age group. In different communities. And ultimately, for us here at Newport News, and just like Poplar, we want to be a part of those solutions. We want folks to know in the community that, hey, we're here, we're available, we are professionals, we have expert psychiatrists, clinicians, counselors, therapists here to do a tough job. And Newport News is about that. And we would also just kind of add in that, it's always good for folks to have the idea of changing their behavior. But you have to have a plan, right? And what I would kind of suggest is you're looking at assessing your situation and trying to figure out why do you need to change? What's the motivation for change? Is it, somebody in your family that's kind of, having those side conversations with you because they're noticing some changes and they see you going down a path that they're not comfortable with and they want to see you get on that right path. It's important that you have that social support and you have those people around you that can help you. But let's be honest. Not everybody has that, Mike. Not everybody has people in their family or their friend circles that have an understanding. Us in this field, we are trained to be empathetic and compassionate to those who are struggling, because the behaviors that come from serious mental health disorders as well as substance use disorders, they're not easy to be around. So that's why it's important that you seek out professional help. You have the new suicide crisis line, the 988. You have a plethora of providers in the community that everybody's a little overwhelmed. There's a lot of needs right now. Everybody's kind of seeing the similar staffing challenges. And again, why folks like myself and Eugene, you need to have a growth mindset to meet that challenge and to meet those tough days that are going to be here inside our inpatient setting or our residential setting. The days are tough, but we work together. We understand that as a group, there's not a lot that we can't accomplish. And the better that we work together here at the site level from all of our direct care staff and our support staff, just helps us meet the needs of the community in a better way. And at the end of the day, that's what we're here for. But again, if you ask me what's better than a New Year's resolution, I would say a growth mindset, a long-term commitment to behavior change that is going to improve your wellness, your physical, your emotional health, and building that social support system around you. Sometimes people have to come in contact with the continuum of care, right? To learn what resources there are available to them, because at different times in the continuum, folks have different needs. Not everybody needs inpatient services. You know, some needs can be met in the outpatient setting, and that's why it's really important that as providers, we are ready to take on those needs, and we have the capacity within our operation to do so. So we're here to help. We want to be a part of the solution, but at the end of the day, we would preach that folks make a long-term commitment to behavior change and realize that it is hard. It is not easy. It's much easier to do it when you have a plan, when you understand what your motivating factors are, and that you have collaboration with professionals to support you in that process.
There you go. On the mic, Mike King here. We got Thomas and Eugene, Newport News Behavioral Health Service. Now, I always ask the folks when I talk to the people up at Poplar Springs, our good friends there, how are people doing out there? So, we're not sure whether we're coming out of COVID, the isolation piece. So I always ask, how are we doing, say, as opposed to 6 months ago?
Hey, Mike, I'd like to take that. I mean, people are stressed out there. I mean, we are living in very critical times. It's very difficult. And I'd like to, speak to the parents out there. The world we're living in is not like it used to be anymore.
No.
That we're seeing from children, the influences from media, from social media, from video games that they play, from peer pressure at school, from substance use, and all of that is just too much for them to take. And sometimes, the parents cannot do it on their own. And they need to be able to see the signs that they finally need to surrender to professional help. So, that's why we have an acute center where parents can bring their children for an in-person walk-in assessment to determine if their behaviors or decompensation they can use immediate hospitalization to address their psychiatric needs. So we have that in our acute center, and they can have an assessment, and their children will get the treatment that they need short term. And then when they discharge, we recommend more outpatient treatments, less restrictive treatments out in the community for them. So we're trying very much as possible to partner with services out there in the community that is more engaging with families in their homes, and therapy, outpatient therapy, so that they can have that continuum of services that Thomas described earlier. But if you check the pulse of families out there, it's stressful. Right?
It is stressful. All right, so let me ask you, so you guys are on the front lines of making this happen. What are some of the signs that, and so we just come through, and I had Kent on a couple of weeks ago. We talked about suicide after the suicide at Twitch. That is the extreme part of it. What would parents look for in their kids that would cause them to be like, hey, I need to call Newport News up and get with them immediately? And is it any difference between, say, boys and girls?
So I would start out in saying a good indicator for a parent to be monitoring from their children is their sleeping patterns. Because what we know in the mental health and substance abuse realm is that if you are not sleeping, it is very difficult to cope with the day-to-day functions of just being a person, being a human. So parents noticing kids that are staying up later, not getting up, going to school on time, not trying to go to school at all. We see a lot of indications from the school setting as well, in where children are starting to develop and exacerbate certain behaviors that are too large for the school setting, then we may get a referral from the school as well, right? Not only from the parent, but the school's teachers, counselors, nurses who are seeing additional behaviors in the school setting. So parents want to stay attuned to any kind of drastic change in normal behaviors of their children. Are they not participating in certain activities that they used to love? Are they, spending too much time just kind of isolated in their room and not kind of, interacting with their friends or even interacting with the family, right? So I think you have to have a baseline of your child and understanding what their normal behaviors are, and really just kind of taking a deep dive in some indicators that, pointing in on a one simple example would be their sleeping patterns, which a lot of our health and wellness, that's the foundation, right? How you sleep, how you eat, are you hydrated? Those simple things that we take granted for, honestly, on a day-to-day basis are so important to our overall health. So parents want to be equipped to understand just the subtle changes in their child's behavior. Isolating to their room. Is this something that they do on a regular basis, or is this something that just changed? Most of the time they're out in the living room, watching TV, hanging out with mom and dad. But all of a sudden they come home from school one day and they're spending more and more time in their room isolated. We know the real battle in life is going on between our ears. And sometimes the only way to let people know what's going on between your ears is to ask good questions. And I think what's most prevalent nowadays, when we look at the suicide rates increasing, a lot of people aren't comfortable just asking that question. And you don't have to ask directly, hey, are you thinking about committing suicide? But what about self-harm, right? What about just the basic harm? Because kids do those types of things. They cut, they hit, they put themselves in dangerous situations. And parents just really want to be cognizant of any kind of subtle change in their child's behavior that's outside of their normal understanding of what their kids do.
So let me ask you, so is there any difference between boys and girls, or it's sort of that's what you should look for there?
Yeah, I mean, I'm not sure. I'm not really sure about that one. That's a good question.
I would say, to be very honest with you, parents know their children.
Okay.
In the world that we're in, it's very difficult to pinpoint and tell you bullet points, because we are not the experts of your household. We are not the ones who are in charge of your children. So behavior changes can manifest in different ways. But the key things that we need to be looking out for is, like Thomas said, their sleep patterns, their isolation, their friends. Don't be afraid to know what they're doing on their phones. There's bullying and influence on their phones and access to drugs online. And parents need not to be afraid of being involved in their children to the extent that they're able to see these things and notice a pattern in change and then seek professional help now before it's too late.
There you go. On the mic and Mike, we got the gentleman from Newport News Behavioral Health Centers here with us on the mic with Mike. So we're talking serious topics here. So now I see what's happening in my household. I need help. How do I contact you guys? And walk me through the steps, so that, because when we contact you, I feel like the world is crashing down on us, and all we need is some help. So how can we contact you, and then what are the steps we take from there?
Very good question. You can contact us 24/7. Phone number 757-888-0400. That is area code 757-888-0400 24/7. We'll answer the call and then take it from there. Sometimes referrals would have to be sent to us by fax or by email, but someone will be available to answer the call. You can also check out our services on newportnewsehc.com. It has all of our different treatments and different programs on there. Or you could call and request someone to come out and speak to you about the options that they have. Even parents, that's actually my job. So if a parent should pick up the phone and say, hey, look, tell me more, I'll be glad to pick up the phone and call them, meet with them, and tell them about what we do, so we can get a referral and then work with them. If it's something that our services is too extreme, we can point them into less restrictive services. And Mike, what that means is because we are an inpatient setting, we might assess and realize, well, we can connect you to outpatient therapy, or we can connect you to in-home counseling. We're not here to grab all business opportunities. We want to do what's in the best interest of the child and their family. Absolutely. So if our setting is not the best and another facility is, or the community is, we will encourage that. But it starts with giving us a call before it's too late. Mental health is such an important thing that we need to tackle it before it gets too late.
Is that what you guys call wraparound services?
Right, you got it.
That's what I'm talking about. See, Lamar and Kent, those guys, they schooled me.
Yeah, you learned. Yeah, that's wraparound services. So
okay, alrighty. So now we got the problems. Let's talk about the services that you guys have, and where we go from there, from a holistic standpoint. And then Thomas, I want you to touch on culture, and I've had the conversations with Kent about compassion fatigue, and Thomas, you're the man who has to set the culture so that you don't basically run the team that you have into the ground.
You want to jump into services first?
Okay. So services, so we're divided into two different categories. So we have residential treatment facility, which is a little more long-term services, where the youth live with us here on our campus. It's usually about a 6 months treatment period. And we take both boys and girls from age 13 to 17. And we treat an array of issues like complex trauma, girls that may have had some type of complex trauma or have been exposed to sex trafficking. We have a special unit for them. We have a special unit for boys who have sexually reactive behavior. And then we also have what we call general psychiatric, which is youth that have emotional issues that need general residential treatment. So all of that is in our residential facility. And then we also have our acute hospital, which is more short-term. It is for children 8 to 17, where they come in, they're decompensating, families can't handle the situation, they need professional help. So our doctors determine that they need psychiatric help, and they stay with us for about a week. We stabilize their behaviors, we stabilize their medication, and then we recommend less restrictive treatment for them out there in the community. So those are the two different types of services. Now, New Year, I'm going to leave you with this, Mike. So Mr. Thomas is our new CEO, and he is very interested in starting a substance use disorder program. Now, that's very important because previously we couldn't treat you that have substance use disorder as their primary diagnosis. But Mr. Thomas is now starting this program sometime in the summer, where we would have youth that have substance use as their primary diagnosis. We will be able to treat them. And there's a need out there in the community, and we are just more than happy and excited to fulfill that need out here at Newport News Behavioral Health Center.
When you guys launch that, as we go down the road, make sure you come back on, because that is something that's very serious. I know everywhere you turn, you're talking about the opioid crisis, whether it's fentanyl or whatever is out there. It's something that needs to be talked about. So, kudos to you guys for doing that. And any way that we can help get the word out, we'll let you know. So Thomas, you're the new man on campus, and you're setting a culture there. Let's talk about that, because everyone knows about the shortages of people, and you guys are in a tough business. You hear a lot of things, you see a lot of things, and I always ask professionals, how do you guys see and do with it without it sticking to you? Because we take this home.
Yeah, you're right. And from to simplify that, you're talking about capacity, operational capacity, like how much can we really do to help the community, right? There's that kind of thing that I have to focus on. But then you also have to focus on the individual capacity of our staff and what they can handle on a day-to-day. Because again, if you're talking about not being fully staffed or 100% staffed, or having those additional positions that you like to have in your operation, then that means that other people are picking up maybe an additional shift, staying a little bit later here and there. So first thing is you want to have a culture that prioritizes self-care. And self-care is an individualized approach, right? What works for me may not work for Eugene. What works for Eugene may not work for you, Mike. So I can speak from my own personal experience and how I kind of go about establishing this in our culture is I speak to our teams about the things that I do for self-care, right? I tell them that, hey, for me, it's about getting home at night and just kind of having a little bite to eat and hanging out with my daughter, man. That's it. You know, I just want to sit with her, spend the time, soak up that moment. I think another important point is being mindful, right? Being present and knowing that, hey, when I'm at work, I'm at work. I'm present. I'm fully focused on what's in front of me. But when I leave, I'm not at work. So I want to turn that work mindset off and let my brain kind of relax. And I want to get home or want to get into my space or want to have that simple routine that's going to help me kind of decompress. Because what I do, and my rule is, I don't take work home with me at night if I don't have to. You know, so once I get in the door, I'm dad, right? I'm dad, I'm partner, I'm doing those roles that I need to do because being a father, being a partner, that is at the core of who I am. I am obviously a CEO and I do have a huge responsibility here, but I'm very confident in the team that we have and the senior leadership team that we have and the middle management folks that we have to push that culture forward and to encourage folks to participate in self-care, to encourage our senior leadership team to have these tough conversations about how do we continue to further our community here? How do we bring our staff closer together, right? Because like you said, Mike, this isn't easy stuff. This is very stressful at certain days. And as Eugene spoke to, you know, the difference between a kid coming to our center and not coming to our center right now today, Mike, is basically safety. And I don't want to oversimplify the assessment process, but kids that come to our service, they're here because they're not safe in the community. And that speaks to both on our residential side and our acute side, right? So, you know, in behavioral health trend is that, hey, you never want to put a kid in inpatient or residential if they don't need it, right? So the first attempt is always to stabilize them in the community with different levels of care. Now you have IOP, you have PHP, but sometimes those services don't work and young people need a higher level of service, which would mean maybe a short-term stay at our acute hospital or a long-term stay in our residential setting. But what's clearly important here is that one, we understand our staff that are doing the job. We understand what their challenges are. And as leaders, we are solving problems, right? That's basically what I do is I help our senior leadership team, staff with ideas, suggestions, but kind of help them push things forward because, hey, we're all busy. We all got things coming at us from left and right. But it's important that you have that team concept. The culture is come to work. We want to provide a service of excellence. We want to have a balance where folks can actually put in their PTO time and get some downtime. We want to make sure that this is a place that folks can come and get a good start, either starting point in their career or new opportunities because they're passionate about serving this population. And I will also tell you this about our field, Michael, folks in behavioral health. We are a resilient bunch of folks. We do this because most of us have experienced something in our life that's beyond our control. And we made it through that, right? We build that resilience so that we can extend our hand to another person in our society that is also struggling. And maybe we can show them that it is possible to change that behavior, to build that resiliency, to have a better quality of life. Because at the end of the day, it's about quality of life. Life is not that long, it's short. We're here for a minute. But I want to be mindful and present where I am. And if I'm at work, I'm present with my team, discussing ways that we can improve the service that we provide. But if I'm at home, I'm dead, you know. But Eugene may call me at night and, you know, he may have a call for me or something like that. And that's okay because that comes with the territory. I understand that. My family understands that. So communicating that expectation to my family is important. And also setting that boundary with our team members is also important as well.
So it's great. Thank you for taking the time. So Thomas and Eugene, I just want to be clear with this. So on New Year's Eve, it strikes 12 and it turns into New Year's Day. If I haven't done anything different, nothing's going to be different on New Year's Day. The same foolishness I was doing before, the same struggles I had, I'm still going to have those on New Year's Day because I haven't done anything.
That's right. Again, if we simplify it, you have to assess where you're at, right? Is it a dire situation, Mike? Right? Are you you're waking up in places you don't know where you are.
That's a problem, sir.
Situation. You need some help. You need some immediate help, right? Or is it one of those real small things that you're just, kind of like your Achilles heel, that one thing that you kind of haven't been able to get over the line? Maybe you don't need professional help for that. Maybe that's a friend or a family member you can confide in, but you have to share your challenges. We have to reduce this stigma, especially amongst men. We're 3 guys here. And
I'm good.
It has to be okay for us to say, hey man, I'm not okay. I just need somebody to talk to. And from there, you can move forward, right? Maybe it's just that side conversation that kind of helps you reduce that stress, gave you some perspective. Or maybe if that's the catalyst for you reaching out and getting some professional help. I would encourage everything. Changing behavior is not easy, but it's so rewarding. And it is so rewarding, man. When you've had that challenge in front of you for so long and you built up that motivation, you leaned into a social support system. And the great thing about us is that we want to be the cheerleaders, right? We want folks to come and get our service, get what they need, build that toolkit, and get on out here back into the community and live a good quality of life. We want to cheer them on the way to do that. And again, I'm cheering not only our residents and our patients, but I want to cheer our staff too, because they do a remarkable job every day, 24/7, caring. Right now, we're up to 70 kids right now. That's 70 kids that are being met 24/7 here at Newport News alone. That is something for me to be very, very excited about. But again, we want to operate in excellence. We provide a great service and make sure the community knows how to get in contact with us. So we help. Thank you a lot, Michael, for the platform you're giving us today, just to speak to what we do, to let the community know we're here to help.
You know what, man? I like that, operating excellence. I'm straight up stealing that. I'm taking that.
Mike, I stole that from my good friend of mine. The best friend of mine is he's a major in the Army, and he's working under a really high-ranking guy. I think he's like a general or something. And that's his thing. And I said, hey, explain that to me, man. What does that mean? Operating in excellence. That's a growth mindset.
That truly is. I like that.
You have to have a growth mindset to get to that. But that's what we'll preach, Mike. And again, operating in excellence is good for everybody.
Good enough. So now you guys know how it works, friends of the program. You got anything going on that you want to let the world know about? It doesn't have to be like this right here. You just hit me up, and what we'll do is we'll get the word out. But thank you for coming on. So really quickly, Eugene, how can people find you guys out there?
Yes, so we are at, you can call us at 757-888-0400. And 24/7, someone will answer the call. If you need anyone to explain our services forward, I'll be the man for it. I'll come out and explain into details what our treatment is all about.
There you go, gentlemen. It's been a pleasure. On the mic of Mike, Newport News Behavioral Health Center. Those guys are doing some really big things out there. We're coming through time, so don't let it be a new year and you have still some of the same problems that you had before. Get help, because help is out there. Gentlemen, I'd like to thank you for coming on. On the mic of Mike. We'll talk to you soon. Thanks now. Take care.
Thanks,
Thank
Mike.
you.
Have a good one.